I'm glad everyone was able to join us. We will have a couple of guests talking with us today. I've invited Tim Shelburn, the president of Collection Sites, LLC, from our Nevada location to join us. I've also invited Dr. Glenn Copeland, and Dr. Copeland is joining us from Toronto. And I'll ask both of these gentlemen to participate along with me in the webinar this afternoon. Before we get started, however, I'll ask Aaron Ayton to go ahead and read a disclaimer. Aaron?
Thanks a lot, Doug. The purpose of this call is to provide investors with an update on QuestCap's business development with a primary focus on its subsidiary, Collection Sites. During this call, QuestCap may make statements that contain forward-looking information within the meaning of applicable Canadian securities legislation. Forward-looking information will include, but is not limited to, statements with respect to the results of Collection Sites cubes, the proposed rollout of additional testing sites, the pursuit by QuestCap of investment opportunities, and the merits or potential returns of any such investments. Forward-looking information is subject to known and unknown risks, uncertainties, and other factors that may cause actual results to be materially different from the conclusions, forecasts, or projections expressed or implied by such forward-looking information. Certain material factors and assumptions have been applied in drawing the conclusions or making forecasts or projections reflected in the forward-looking information. A description of the factors that could affect and the assumptions underlying forward-looking information can be found in QuestCap's annual information form, financial statements, and accompanying management discussion and analysis, as well as public disclosure documents that are available for review under QuestCap's profile on SEDAR. Participants should not place undue reliance on forward-looking information. QuestCap does not undertake to update any forward-looking information except in accordance with applicable securities laws. Thanks.
Great. Aaron, thank you very much. And I'll give a little bit of a brief agenda for what we're going to cover this afternoon. We're going to start with an update on our Collection Sites subsidiary, and I'll ask Tim Shelburn to join me in that. We're going to spend a little bit of time talking to Dr. Copeland about the nature of the virus as it sits today, the vaccine programs that are being rolled out, and some of the requirements ongoing for testing. And we're also going to address some of the concerns that shareholders have had. One of the areas I would like to address is what are our plans beyond the current requirement for COVID? We've got some plans in place that we think are exciting. We want to share with you today. In order to make this a little more easy to follow, I'm going to share my screen and pull in a presentation. Can people see my screen? Evan, is it?
Not yet, Doug.
Okay, let me just.
There we go.
Okay, great.
You're up and running.
I think most of you in the previous webinars are familiar with the Collection Sites and the model we have for our solution to ultra-high demand COVID testing. What you're seeing on this page are the two types, the formats of the testing sites that we are establishing across the country. On your right-hand side are the initial cubes that were established in California. They're window sites where the patient walks up to the window and the tests are performed. We realize that certainly in some of the colder climates in the Northeast, et cetera, the Northwest, where certainly our expansion plans are well within those markets, we also have sites that will allow us to have testing indoors. And you'll see on the left-hand side the models that we are now putting in place across the country, and we'll talk further about where those locations are and what the plans are for continued growth. We have a national footprint with Collection Sites. We are now operational in 32 sites in many states across the country. California was our initial pilot. We are in Nevada, we're in Arizona. We've established numerous locations in Indiana, as well as Florida. We are completing our phase 1 rollout. We have 13 additional sites going in place in places like Texas, Oklahoma, Missouri, Kansas, and in areas across the Northeast. After that, we have 63 additional sites that will be placed in the very short term. And Tim, can you give us some update on the phase 2 locations?
Yeah, so thanks, Doug. Yeah, the phase 2 locations next week will actually be broken down by state, which is going to be 3 in Texas, 6 in Pennsylvania, 1 location in Virginia, 1 in Oklahoma, 1 in Kansas, and 1 in Maryland. We also are going to be in the 63 locations we're going to be installing between December 28th and January 7th.
Okay, and then the goal is to target additional sites, 50 more as part of phase 3. And we target high population centers countrywide. We currently have, as we've mentioned in the past, 740 sites under contract as we speak. Our results to date have been very impressive. Yesterday was a record-breaking day for collection sites. We were 5 tests short of 3,000. We did 2,995 tests. We averaged $95 a test and brought in revenue of just shy of $300,000. If we actually took the month of December, we flattened the curve from December 23rd onwards to the end of the year, and we have seen a steady growth, but let's, for these purposes, flatten that curve. We will generate in the range of $6 million in revenue for the month of December alone, and that is at a single site EBITDA of around 55%. So a significant revenue has been generated in the month of December, and the trend, of course, is additional sites going in place and additional test averages on the rise. So we don't see this flattening, but if we're conservative and flattened it, it's still a sizable revenue that we're going to generate through the month of December. You will see back on December the 1st, we were generating an average of around 41 tests per site, and we did 94 tests per site yesterday. Our high point was 105 on December 14th. So we've seen a good steady number of tests every single day. We have a break even in some of our locations as low as 5 tests per day. And the antigen test has been our highest demand and is our highest profit margin. And our marketing spend is very low at about $1,600 per day for all of the current active 32 sites. Tim, anything you want to highlight on this particular slide?
I'd just like to add that the upcoming sites, you can also take a look on our website at testbeforeyougo.com, and you'll actually be able to see the actual opening dates for the upcoming locations.
We have now, we're generating a current rate of 94 tests per day on average per site at $95 per test. That generates an average of $268,000 in revenue monthly for every site we have established and the sites we're going to be opening over the coming weeks. I'll ask Tim to address some of the rollout plans in the weeks at the bottom of the chart.
Yeah, so as I mentioned again, next week we've got 13 locations going into 6 various states. A little bit of delay due to hiring cube staff during the holidays, but next week we're firing back up with the 13 and then following right back in the next week of December 28th, January 7th with an additional 63 locations. And going back, Doug, to the previous screen, we are actually increasing lab assistants per location to increase their daily sales, which will also increase that number dramatically. So,
great. And Tim, I'll ask you to address a little bit about our plans for the future locations and the contrast with our various quality partners.
So listed there, you'll see our current, our landlord contracted partners we have, which is Simon Group, Brixmore, Sandor, Brookfield Malls, H&S in California, and then Tanger recently has just been added. Again, the rollouts totaling by, we're looking end of March, first week in April to have the total of 743 locations deployed. So with luck and permitting across the nation, we should be able to hit that number.
What was, I think, extremely exciting for us is yesterday we had over 15 locations do in excess of 100 tests. We had a number of them exceed 200, and we had one do 313. A sizable amount. It was actually, we had such a high demand at that location. We were able to establish a tent. We had cooperation with our leasing partner. We were able to establish a tent on the site and actually were able to generate 313 tests at one single location. So as I mentioned in the past, the demand is insatiable and we don't see it stopping anytime soon. So if you look at the upside and what we are estimating without establishing additional locations and tents, we can do comfortably about 150 tests per day at a current site location, averaging 95 as an average test per site. You can see the potential revenue that can generate, and we're on our way to establish as many of those sites as possible as quickly as we can. So that's an update of performance up to this point in time. What I'd like to do now is perhaps change subjects a little bit and then talk about some of our future plans, but I'll change subjects right now and ask Dr. Glenn Copeland to give us his perspective. He's been very involved in combating this virus on the direct front line, and to give him his perspective on both the vaccine, what's happening with that rollout, but more importantly, how that's going to impact the need for testing. Dr. Copeland?
Thanks, Doug. It's a pleasure to be here with you and Tim. And on behalf of all of us at QuestCap, I want to thank both you and Tim for a great job. Well done getting us through the last 8-9 months and heading to a substantial improvement in the situation of the COVID world. Being able to get testing and so easily that we can at collection sites has proven to be a game changer for many Americans who are hoping to go home for the holidays. You know, to be able to walk in and get a test done and know that you're negative and going home to visit a mom or dad or grandparents, it's gratifying from a medical standpoint to ensure that we're helping people stay safe. The future of where this is going, unfortunately, is not going to be short-lived. This is a long battle ahead of us. Yes, the vaccine has come out, and I'm pleased to say in the U.S. that Moderna and Pfizer vaccines are out and being distributed as quickly as they can. However, testing will be around for many years. Unfortunately, COVID has a situation that unfortunately it's very contagious, and we are seeing tremendous numbers of asymptomatic people coming to be tested with no symptoms, no sore throat, no runny nose, no fever, no ill health whatsoever, and we're seeing a percentage of these people. So that right now there's 330 million people in America. It's going to need about 1 billion vaccines because most of the vaccines right now are double dose. So we suspect that the two things are going to happen. People are going to need to be tested for quite some time yet with, for the virus. But secondly, there's going to be a tremendous push that we're going to be leading in on the antibody testing. And that is really looking at the efficacy of the vaccine. Right now, we don't know how long the vaccine is going to immunize people against the virus. Is it 6 months? Is it a year? Is it 2 years? Is it for life? We don't know. And, you have to remember that it's only about 55 weeks ago that we even heard about this virus. And here we are with a vaccine already. So we're learning as we go. But as time goes on, and we clearly see the potential of what the virus can do, the after vaccine testing will become critical. People want to know, are they still immunized 6 months, a year, year and a half, 2 years down the road? How often will you have to be immunized? With the flu, we know it's once a year. With other diseases, polio, and many of the other ones, it could be 10 years, it could be 5 years, it could be 30 years, it could be a lifetime. We know, for argument's sake, with shingles, the first vaccine that we came out with was only 60% effective, where the second vaccine is now upwards of 80 to 90% effective. So vaccines change on a regular basis. And until this is zeroed down to exactly what we can expect from each vaccine, testing will be a major part of our lives for the next probably 3 to 5 years. And I'm proud to say that collection sites and QuestCap are going to lead the way once we have 1,000 mobile sites up under Tim's direction. Anybody can be exposed the night before, can be tested in the morning. You can have your vaccine antibodies eventually tested to see that you remain immunized. And this is going to lead the way as we defeat, and we will defeat COVID. It's only a matter of time. But testing, as everybody will tell you in the medical world, will be the leader in how we defeat this. We can't defeat it if we don't know where it is. We can't defeat it if we don't know how long the vaccines are working for. And collection sites and QuestCap will be the leaders in the testing world because of easy access, mobility, good parking, quick results, accurate results backed by great laboratories. So I'm excited what the future brings. A year ago, we didn't know what was going to hit us. 6 months ago, everybody was scrambling. And today, I'm comfortable in saying that we've armed ourselves with the best of the best from great American technology. And I think that the future is incredibly bright, but let's be clear, testing will always be the leader. So with that, Doug, I turn it back to you.
Great. Dr. Copeland, thank you very much. Let me address a couple of things or a couple of questions on that. We've seen in some countries, Dr. Copeland, for instance, Colombia, where because of the vaccine, they are actually going to be testing for antibodies prior to vaccination and immediately following and continuing throughout. Is that what you anticipate, something similar in North America?
Very much so. We've done Pfizer and Moderna have done, these great phase 3 studies. But those phase 3 studies were 3 months. And so we don't know what's the 6 months looks like and what a year looks like and what 2 years look like. And the vaccine companies will be the first ones to tell you they'll be testing as fast as they can the neutralizing antibodies, the T cells. They're going to be looking to see how active this vaccine is. And we want to help. We're going to have a lot of information. So we're not just, going to be doing the testing, but we're going to be helping wherever we can to feed back all the information we can, Doug. But Colombia is a prime example. They don't have enough vaccines, so they don't want to vaccinate people who have antibodies who, they've already had the disease. So they're actually using that to say, well, you've had the disease, you got antibodies, let's vaccinate people who haven't been exposed. But I don't think, thankfully in America and Canada, we're going to vaccinate everybody, whether they've had the disease and have antibodies. But it's going to be a long testing cycle here, long time, because we want to eradicate this like we did with SARS. And we want to make sure that once we get this thing under control, we don't lose control. And the only way you can do that is testing.
Dr. Copeland, one final question we've had from a number of people is the discussion on the variant, the mutation to some extent of what's happened with COVID. Can you address that
Sure.
Not only at the standpoint of the vaccine program, but also in terms of testing?
Sure. So, this story broke about 3-4 days ago and came out of the UK with a variant mutation of the virus. And so the concern obviously is, is the vaccine still going to work? And the thing to understand about this vaccine are the two of them that are out right now, the Moderna and the Pfizer, are both what we call messenger RNA. So these vaccines have been made, they're the first versions that actually use the protein in the virus to build the neutralizing antibodies and the T cells. And so as a result of that, the protein in the virus hasn't changed, but there is a mutation. But this is normal. And quite frankly, we see this in pretty much, the flu is a good example, but we see it in pretty much every aspect. And these vaccines are, in most cases, pretty much encompassing. So in discussions that I've heard with Pfizer and Moderna, they're both very, very confident that the vaccines will, in fact, control and vaccinate against the variant virus. However, you know, they're testing. They're testing every single day, this week, next week. They hope to have a firm answer within 2 weeks. But again, I think medically, most immunologists and epidemiologists and infectious disease docs that I've spoken to are all very hopeful that the vaccine will deal easily with the mutation, and most of the vaccine companies expected this because they built the vaccine again for the protein and not the actual virus.
So I can only imagine that this just brings into more play the whole need for testing. As we get
100%.
mutations and variants, et cetera, which, as you say, is a normal part of what happens in virus development.
100%, Doug. I think, you know, I think we go back, I'm old enough, you guys are too young, but when HIV, unfortunately, the AIDS cycle started many years ago, the one thing we banged home to people in those days, and that, testing and more testing. And thankfully the world listened. And, we're still don't have a vaccine for HIV, but thankfully we have great medical treatments, but testing still goes on every single day for HIV. And that's the way we control it, is to isolate people and get them treated and make sure that they stay healthy. COVID, we've got the vaccine, but it's just the beginning of the fight. And people have to understand that testing, especially in the next year and a half, 2 years, whether it's antibody testing or rapid antigen testing or PCR testing, it's going to be the leader in the fight.
Great. Appreciate that. Thank you very much, Dr. Copeland.
Thanks, Doug.
I'm going to change subjects a little bit now and take some time to address some comments and some questions we've had come in from some various investors and some people participating. The one is around financing. Certainly capital is a big part of us being able to expand quickly. We are looking at some ways of generating some non-dilutive capital. We also have a situation where 25 to 30% of all of our revenues come in now with insurance sales. These insurance sales take anywhere from 15 to 90 days to be received. We are now in very close to closing up talks with factoring agencies to be able to make use of this capital. And we're very confident that those are going to be concluded literally within days. We have other opportunities that we're looking at right now. Needless to say, the other very important situation is that as we grow, our cash generation has become very significant as well. So that also adds to our ability to continue to meet all of our liabilities, as well as to grow and continue to grow. One of the other big areas that people have asked about is the whole what happens after COVID. I think it's important, first of all, to stress that this is not something that's going to be over with because a vaccine is on the horizon. This is something that we are going to see a part of our day-to-day normal operation for a long time to come. Dr. Copeland gave us some exposure to his thinking and some of the thinking of the medical profession. But I can tell you that certainly testing for COVID will be something we'll be involved in as part of collection sites for a good long period of time to come. But I think even beyond that, people have to understand the excitement of this model. We will have in place in 2021 over 1,000 accessible, convenient, and affordable testing locations across the country. It is an opportunity for us to really change the way medical services are provided. We are a medical service provider that gives accessibility, convenience, and cost effectiveness. There is a tremendous number of medical services that can be delivered in this type of model and can be very disruptive in terms of how medical services are delivered in the US and throughout many parts of the world. I am very confident that some of these are going to be extremely important to us in the future. We're looking at everything from immunizations for various types of diseases. We are looking at continuing testing for things well beyond COVID. We are looking for different ways we could work even on things like potential testing for drug testing, et cetera. There's many things we can do that offer an accessible, convenient, and affordable model to the patients. There's a reason why people are lining up at collection sites when other testing methodologies and testing locations are available. It's because we offer those convenient locations. I think it's a model that's going to work very successfully. COVID will be with us for a long period of time, but beyond COVID, we are going to have an opportunity to deliver medical services and be a medical service provider for many years to come in very, very effective way. With that, Tim, is there anything you want to add before we get to a couple of closing comments?
I don't think so, Doug. Again, I just want to reiterate that you can, folks can visit our website at testbeforeyougo.com to see all the upcoming locations and opening dates. So please visit that, and we'll keep it updated.
So just to give some conclusion to the call, I will basically let people know that, you know, the points we want to stress in this call are manifold. First of all, hello, am I? Oh, there. Sorry.
No, we can hear you, Doug. You're good.
I thought I lost people for a second. I apologize. I just want to stress the fact that, first of all, we have a very successful model. It is now proven after a number of weeks to be able to generate substantial revenue, substantial EBITDA. And we're going to continue to expand that rapidly across the country. Tim and his entire team, and the team is certainly growing as we speak. That team is actively installing in our contracted locations throughout the country. We are successfully able to generate revenue and financing to be successful in our installations going forward. This is a model where detection and the antibody status of patients is going to be with us for years to come, as most medical professionals would support. And also importantly, we will be a medical services provider for a number of different medical services across the nation, conveniently with accessible and affordable offerings for patients. So with that, I'm going to take a look at any questions that I can address immediately, and other than that, we'll call it to an end. I've had a question about the insurance. Somebody asked specifically about the insurance. It is 25 to 30% we're averaging now with insurance sales, and as I mentioned, we are looking to factor some of that receivable because of the time that it takes. We believe somebody's asking how big will this market be in terms of potential sites. I would say that it really is it's as big as we can affordably access, and we're getting better and better at being able to do that. I would say the ability to have thousands of locations is not unheard of. I would certainly like to see us in excess of 1,000 by the end of 2021. And again, that will add to the longer term model of us being a medical service provider right around the corner from most of the American population. And I think that's everything.
Doug,
sorry.
I would just add a quick comment about the name change.
Oh yeah, absolutely. Sorry about that, Evan. We've announced in the past that we are in the process of establishing a new name for QuestCap. We, as part of our move to the NEO exchange and our movement from an investment issuer to a single purpose medical technology company, medical services provider, we are changing the name to MediVolve. We have had shareholder approval for the name change, and we're just awaiting some regulatory approval, and we will begin to utilize the name MediVolve in the future. So in 2021, you will see the new birth of the company under the branding of MediVolve. And with that, I want to thank everyone for your time today. Tim, Dr. Copeland, thank you for joining. Evan, thank you for arranging everything, and Aaron. And we'll be certainly keeping you informed. We'll be doing these on a regular basis, and we'll announce the next webinar very shortly. Thanks, everyone, and appreciate any questions. Please don't hesitate to send them in to us, and we will do our best to address. Thanks. Have a very Merry Christmas and a happy holiday to everyone.
Thanks, everyone. Thanks, Evan. Thanks, Dr. Copeland.